Hi Marion, and thank you for agreeing to do this interview with me for my blog. Before we kind of get into the interview and the questions that I'd like to ask you about motivational interviewing, I wonder if you could just tell the listeners what your role is in Cornwall.
Hello Karen, you're very welcome. Yes, my name is Marion Russell and I'm Head of Service for Practice Development and Safeguarding Standards in Cornwall Council. I was for a number of years the Principal Child and Family Social Worker in Cornwall, and in that role I had a lot of responsibility for workforce development and the Learning and Development Programme in Cornwall Council, and while that's not really my job now, I still have an overview of it.
Okay, thank you. And obviously we've met numerous times through the years as I've been delivering the motivation interviewing training in Cornwall, I think for about 8 years now. And that's been such a rewarding part of my career. And I've been writing this blog every week now that we're in this kind of virtual way of working, and adding different things to the blog each week to keep the motivation interviewing approach bubbling in both Devon and Cornwall and other areas where I work. And I just thought it might be nice to hear some of your thoughts on the approach and kind of how it applies. So I've just got 3 or 4 questions to ask you, so this won't take up too much of your time because I know you're really busy. My first question is, what do you think of motivation interviewing? I mean, I know that you have done the training and I know you've been involved in it, but just kind of generally, what do you think of it as an approach?
I think motivational interviewing is an excellent approach in working with families, with children and with families. And the reason why I think it is such a good approach is because we increasingly know that the best way of working with families is working in partnership with families. In Cornwall, we've developed a whole strengths-based social justice approach to our practice, and anything that enhances that or gives us extra tools in developing that way of practicing, I think is really, really good. And motivational interviewing is absolutely key as part of that. We all know ourselves that if we want to do anything, make any changes in our lives, to have, to know what your motivation is, to have that motivation there to do it makes such a big difference. And it's no different for families. I mean, I don't know about your listeners, but I certainly know that when I'm wanting to make changes, to have support in doing that and having somebody help me work out what my motivation is, what my goal is, and how I'm going to get there really, really helps. And it's that kind of support that we want to give families. We have to acknowledge that in local authority social work, it is statutory social work, but that doesn't mean to say that how you do things can't be in a partnership way, working on the relationships and helping families who are actually the experts in their own lives, helping them work out what changes they want to do and how to do it. I think it's such a good approach for myself. Apart from anything else, anybody that knows me tends to know that I can be quite directive, and it's really good for me to stop and think about how to motivate people, how to get really down to what people want to do and why they want to do it and how to get there, rather than telling people what to do. And all the research shows that if you work with people and people have some control over what happens in their lives, then there's a greater chance not only of them making the changes, but more importantly, that the changes stick and difference is made.
Yeah. It sounds like you're saying you can relate to this on a personal level, and you can also see the benefit of it going hand in hand with lots of other ways of working in Cornwall and the difference that can make for both individuals and families.
Well, I think we've got to remember that we're all human beings. In social work, you are the instrument of your practice. Doctors have, various, tools that they use. Plumbers have tools. I'm not necessarily saying that social workers are plumbers, but if everybody has tools of their profession, and in social work you are the tool of your profession, and so how you are as a human being and how you relate and understand human beings is very important, because that as the tool of your profession, how you use yourself and understanding how that works is really important in what you do. And I also think that, you know, in social work is about society, about families, it's about relationships, and you can't separate who you are from the people that you work with.
You're really describing the spirit of motivational interviewing and this idea of working collaboratively with people. We're working with rather than doing to. And you also use the word expert there. I like this idea that motivational interviewing is about there being two experts in the room. So as you say, you take yourself into the room and your expertise and your knowledge, and at the same time you're working with families who are also the expert of their situation, and you're drawing out their kind of motivation and their expertise. And I really hear the things that you're saying really fit with the ethos and the spirit of the approach. How relevant do you think this approach is in social care?
I think it's really, really relevant. When you think that the work that we do is conversations with families, it is visiting people in their own homes, conversations with families, you have to have some kind of framework in which you do that. You have to have some kind of understanding about what it is you're doing and why you're doing it. And while people may stumble into doing motivational interviewing, and that might be some people's natural way of working, unlike me, who tends to be a bit more directional. But then that's because I have teenage sons. So yes, people some people work in that way naturally, but to have an understanding about what it's you're doing, the framework within which you are doing it, and to have that to fall back on, I think makes a big difference. You said earlier about there being two experts in the room. I'm not sure that all professionals would necessarily think that they're experts, and quite often we're not always sure about what we're doing and why we're doing it. But if you've got that as a tool in your toolbox, you've got a whole methodology, a whole framework to fall back on in doing what you're doing. So it kind of makes things a bit clearer for you. Yes.
You're describing there a kind of way of being, and then skills within a framework that you can use. And so would you recommend that practitioners, you were saying some people can use this naturally, would you recommend that practitioners receive training in motivation interviewing? Do you think it's worthwhile for them to take part in that training?
Oh, absolutely. When I say they can do it naturally, it's just, I think, different personalities and different approaches to life. People approach things in different ways. So it's kind of probably more their preferred way of working as opposed to other preferred ways of working. But I think for everybody to understand it is really, really helpful. And I don't think that you can understand what it is you're doing and how the whole framework works unless you have training to do it. And when you do have that training, some people will get it more quickly than others. Others will understand it and not find it so easy. And sometimes, and you also, it's as I say, to keep going back to the analogy of a tool. So there are some situations where it's not the right approach, and other situations where it is. So I'm just thinking about a toddler. If a toddler was about to run in front of a car, you wouldn't be trying to find their motivation not to do that. You'd be stopping them doing it. But when you're trying to get them to eat their dinner, there might be you'd be thinking more of the motivational approach rather than just saying eat your dinner like we were told when we were young. Don't know where I got that one from, but that's just a very simple way of looking at the different ways of how you approach what you do.
So what you're saying is there's a time and place, and it's useful for people to have the training and to also recognise when motivation interviewing is a really relevant way of working, and to also acknowledge there are other ways of working at different times. Motivation interviewing has been being delivered in Cornwall for the last 8 years. What would you say the impact of that training has been within the county?
I think motivational interviewing has been a major factor in the cultural change in Cornwall. Cornwall has been through a great deal of changes in the last 10 years in which I've had this kind of role in what Cornwall has done. And we have moved very much in terms of Monroe from compliance to relationship-based, strengths-based social justice way of working. And if that's your philosophy, and if that's how you want to work with people, then your motivational interviewing has been a major part of doing that. You can say these words that we are strengths-based and that we use social justice approach, but unless you've got something that's actually showing that you're doing it, then that can be a bit of rhetoric. And motivational interviewing absolutely proves that you're being honest about the approaches that you want to take, and that you mean it, and that you're going to do something about it. We have a very big and successful early help offer to families in Cornwall, and you'll know that early help is before you meet the statutory threshold for social care involvement, and at those stages is when you're working early on with families that you want to help families make the changes that stop situations getting worse, and motivational interviewing is absolutely ideal for that. And even when families are in situations where the threshold for statutory social care is met, again, if you can work with families using their knowledge, their expertise, encouraging honesty, because that honesty is what you need to be honest to be able to make changes. And I think that the motivational interviewing does that, and I think it's been a really key part of how everybody operates. It's kind of like it's almost kind of hard to go back and think about it without it, because it's kind of been there for so long that everybody knows about motivational interviewing, knows that what it means, and has some level of skill in using it. And I just think that's perfect. That's how when your culture has changed is when people can't even really remember that we didn't do it, and people don't say what's motivational interviewing because everybody knows what it is, because everybody's using it to some extent.
It's been an incredible experience for me to work with the whole county of staff, and to have been coming back and forth all this time, and to actually hear it as a language and as a culture. And now as new people join and they come into the training, they're so enthusiastic. People rock up for the training and they want what everybody else has had. And for me as a trainer, that's such an incredible experience. There's a buy-in before the training even begins, and I think you've really created a culture in Cornwall of this idea of working in partnership with families to try and help them to improve their lives. So it's been incredible to work with you and the whole county. I've really enjoyed it.
Well, that's lovely feedback, Karen. That's really good to hear. And I mean, as we've discussed as well, we haven't. This hasn't just been with social care. We have extended the motivational training to our colleagues of different professions and disciplines. So we have our health visiting colleagues coming along to the training, and across the whole partnership, because we're all working with the same families and the same children, and we want people's experience to be positive. And similar kinds of experience across the board. So, that's really good feedback. Thank you.
The other thing that I would just finish with saying is, with this terrible time that we're facing in the world at the moment, the movement to virtual training was actually made possible by Cornwall. I was quite belligerent about the whole idea of virtual training, and my kind of guinea pigs were Cornwall. And as you say, we had a real multidisciplinary training group of health visitors. We had people who were working with older adults, people who were working with families, a whole range of practitioners. And they really went for it on the virtual training, and they taught me that actually this approach can be certainly introduced and taught.
Well, again, that's great feedback, and there is something about Cornwall being where it is, and that has helped us in terms of our investment into training and our wholesale. Everybody getting on board. We're not an inner city authority. We don't have access to lots of different resources. Across the board. We're a large rural county, so we don't have experts or resources or services everywhere. We have to be that ourselves. So our workers have to be skilled and knowledgeable themselves, because there's nobody else to refer them to. And I think that bit about, being at a distance has also helped us to embrace the virtual world as well. We're because of, the reasons that we know of, we've had to kind of embrace a virtual world. And I think we are getting reasonably good and reasonably skilled at it. And I think as well, in terms of, for somebody who has to think about, balancing training needs with a busy services, etc. Being able to do training virtually, where you can, when you're in your own home and you can concentrate, and you don't have the travelling and you don't have all of those difficulties, you can really concentrate on it, and do your learning in that way. I think we found there's been lots of positives about virtual learning, as long as we're still having those conversations with with whatever system, it's Teams that we use, but with whatever system you have, you're still looking people in the eyes, you're still having those conversations, and that's really important.
So important. I mean, I've made some clips and some audio, so I only have 8 people on the screen at one time, so that I can actually open up a discussion. It's cameras on, it's talking, it's really thrashing it out, talking it through, loads of different opinions, while people are doing something offline, then bringing them back onto the screen, and so there's a real balance, so people can keep their energy. But the energy's there in Cornwall. You feel it right from the start. So it's been a really valuable experience, and I really appreciate you giving me your time today, Marion. I really know how busy you are, so thank you for.
You're very welcome. You know that I'm a great fan of motivational interviewing, and the whole relationship-based approach has been really important. And certainly the feedback that we get from people that have been on the course as well is it's that direct conversation, relationship, one-to-one training that really works too. It's quite funny actually that we're talking over screens, and we're talking about doing it virtually on screens, because one of the great things about your training has been that you don't use PowerPoints. People aren't PowerPointed to death. They actually have to sit and have conversations, and it's great that still happens even though we are using virtual methods. So
I'm all for the conversation. For me, the training is the same as the kind of therapeutic input. It's about people and engaging with people, and Cornwall has always enabled that to happen. So thank you very much for the opportunity of working there, and thank you for this interview today.
You're very welcome. Thanks, Karen.